Hello and welcome to the special summer series of the Things I Want My Daughters to Know podcast. During the month of August, I'll be dropping 2 episodes a week. Double the fun. This August, you're going to be hearing brand new episodes that I will be sharing on all my favorite topics of menopause, women's health, symptoms, midlife aging, living beyond menopause, all the things to do with periods and tracking and all those great conversations that we're having with our daughters. And in addition, I'll be dropping extra special episodes on Mondays that come from conversations I had during my online menopause summit. The menopause summit ran for 3 years, from 2022 to 2024. These are conversations specifically around menopause that are still highly relevant for today, and I can't wait for you to listen to them. So get listening. Remember to rate, share, refer, recommend, do all those amazing things that we ask you to do when you're listening to a podcast. But most importantly, have these conversations with the women in your life, with your daughters, with your sisters, with your best friends. Make sure you are sharing your favorite episodes with them. And I can't wait to have you comment and tell me what you're thinking about the conversations I'm having. Let's get on with the episode. Hello, everybody, and welcome back to the Menopause Summit. I am Jacqueline, your summit founder and host, menopause educator and coach, hormonal health specialist, and I am really super excited about today's conversation. I'm excited about all of the conversations, but this one is going to be really super practical and super informative, and it's going to get to the heart of one of the issues that is really central in the menopause conversation. I am joined today by Dr. Gordon Cohen, Gordon, I never know which way around it goes.
Barbara Gordon Cohen, yeah.
Barbara Gordon Cohen. And she is a bioidentical HRT, hormone replacement therapy specialist. And today we're going to be talking all about HRT, hormone replacement therapy, hormone replacement treatment, from a conventional perspective, but also from an alternative perspective. Dr. Barbara's speciality is bioidenticals, and we're really going to get down into that whole conversation. It is a big conversation. There are lots of assumptions made about this conversation. So I'm super excited to have you here. Introduce yourself, tell us who you are, tell us a bit about your background, and then we will start with our conversation.
Okay, great. So I'm Dr. Barbara Gordon Cohen, and I had a practice in New York for 30 years. I'm a family practice physician, an osteopath, and I work with integrative medicine, functional medicine, osteopathy. And if you want to, you can know more about me by visiting my website, and that's drbarbara.com. So feel free. And yes, I've been working with...
I just want to point out that functional medicine and the approach of functional medicine is definitely the approach that we're taking here at the Menopause Summit. We have had 2 functional medicine specialists that are talking in this summit. So you're in the right place, because that is the sort of generalized approach that we're taking here.
Right. So basically, I've been working with bioidentical hormones since 1991, and I worked with a practitioner who himself was a psychiatrist, but decided to go into more integrative health. And back then, there was the ACAM, American College for the Advancement of Medicine, where all these big, all these doctors who were into integrative medicine would meet. And many of them were oppressed, I would say, or the government in the United States were very against using natural hormones, supplements, homeopathic remedies. So we really all had to be, careful back then in 1991, and it was probably going on. And since, I know of a pharmacist who has been working with natural hormones in the Midwest since like the 70s, because she had severe postpartum depression and natural hormones were not doing it for her. So she was like a pioneer. So I've worked with a lot of these pioneers and learned from them. And there's a lot one could do.
Okay, so let's start at the beginning of the conversation. Let's start the conversation of why would a woman choose to even take HRT? And we know that HRT has undergone a bit of a rocky road. There was the time when HRT was very, very promoted and offered, for women in menopause. Then there was the time after the 2002 WHI Women's Health Institute report where it was the no-go area and HRT was, considered absolutely a non-option for women. And now it's coming more back into fashion. I know bioidenticals has had a slightly different rocky road, but let's start at the beginning. Why would a woman even consider HRT?
Because of quality of life. So if a woman is going through menopause and is having a really hard time, especially having insomnia, anxiety, depression, severe fatigue, severe hot flashes, and it's not, you're trying everything from yoga, meditation, natural herbs, and you're not really getting where you need to get to, and you're suffering. And this is really where it comes in. You don't have to suffer. You can live a healthy, normal life without having these issues. That dryness is another one, which doesn't have to be if you're on, whether it's a natural hormone vaginal cream or systemic bioidentical hormones. Some people get chest pain, and that could be because they could be in perimenopause and they could have very low estrogen and progesterone, and that would just take away the chest pain. So it's something that conventional medicine like ignores. Like, quality of life is extremely, extremely important. I mean, you don't want to go on another day if you can't function. So it's very, very important.
And what would be the situation, or why would someone, in your opinion, choose or what are the benefits of bioidenticals versus regular HRT? Sort of how did the whole bioidenticals sphere come into it if you have these synthetic lab-produced HRT that, work? What is the advantage, or why would someone choose to go in the bioidentical route?
Okay, so for instance, so each hormone is another story, but
so maybe you want to talk about the hormones, the different things, and go as deep as you'd like to go. This is a fascinating topic, and I really want the women here to understand it.
Okay, so for instance, progesterone is they call it methyl medroxyprogesterone. It has a carbon and hydrogen atoms added to the progesterone to make it synthetic. And there can be many side effects with the synthetic hormones. The synthetic progesterone can cause nausea, mood swings, depression. I think those are the biggest ones for the progesterone. Bloatedness, possibly, and you just don't feel good with it. The estrogen is now they have estradiol, most estradiol, and they have estrone. Those are the two types of estrogens that are synthetic. And again, the synthetic estrogens can cause bloatedness, possibly blood clots, possibly, the conventional world talks about heart disease and cerebral vascular accidents, strokes, whereas the bioidentical hormones, we're using mostly estriol, not estradiol and not estrone, but estriol. So it's usually, it depends on the individual. Estriol is not as potent as estradiol. So sometimes we have to use a little bit of estradiol, but it's usually, on average, it's 80% estriol and 20% estradiol. Sometimes it's 70% estriol, and sometimes it's 50-50. Depends on how severe the symptoms are and how the person responds to the 80-20% of the and estradiol. And you don't get the bloatedness and the fluid retention as you would get with the estradiol. You don't get those symptoms. And actually, there are studies done in the 60s by Dr. Lemon, who worked with women who had metastatic breast cancer, and the estriol actually put them into remission. So it was actually protective against cancer. Okay, so it totally doesn't work. It's also not metabolized in the liver, estriol. So that's another reason to know that this is a very different hormone in a sense, to help with all these symptoms than estradiol.
Do you work with testosterone? What role does testosterone play here?
So testosterone is used when the woman has a lot of fatigue, and the biggest reason is fatigue and muscle wasting, or muscle turning into fat. Those are the biggest reasons why one would use testosterone. It will, help with energy. It's also cardioprotective. Obviously, for women, we're using very low doses. A man's, if I was to give a man testosterone, I'd be giving him anywhere from 50 milligrams to 200 milligrams. That's a man. A woman is, 2.5 milligrams to tops 20. I don't think I've ever given more than 10 milligrams of testosterone.
And I know that with testosterone is less available. As you said, the dosages and the research that has been done for testosterone is mostly in men, and it's adapted for women's dosage, and it's not as readily available as progesterone or estrogen.
Well, in the United States, it's really readily available in compounding pharmacies. Here it is as well.
I know that in the UK it's really not available, and in Australia it's also not really available.
So in Israel, I use Galil Pharmacy, and they have testosterone. They have the cream. In America, it's interesting. You can actually put all of them together: estrogen, progesterone, and testosterone into a lozenger. Wow. So in Israel, I usually do, I could do a lozenger of the natural estrogen, the estriol, 80%, 20% of estradiol, or whatever it's going to be, whatever percentage that person, with progesterone and with the cream of the testosterone that's applied to the inner thigh.
So tell us a bit about the bioidentical HRT, the more natural, sort of, where does it come from? What are your sources? Because obviously it's not synthetic, it's not created in a lab. It may be compounded and formed in the lab, but the source is very different.
Right. So it's from estrogen is it's mostly, well, testosterone and progesterone are from yam usually, and estrogen from soy. So that's where they're getting it from. So it's totally, natural. It's actually wild yam is what they're using. So it's not regular yams, it's wild yam.
That's not yams you buy in the supermarket.
Right, it's not the yam you buy in the supermarket, exactly. So it's a completely natural product. I personally, I've seen women's lives go from literally, like, they'll say, I have my life back. That's basically, I have my life back. I don't have the hot flashes. I can have relations now. I feel like normal again. Yeah. I can sleep good. A big one is the sleep, the insomnia, the anxiety, the depression. These are really big issues, and you can see it go away. I had a patient who she told the doctor she was not sleeping, and he put her on Neurontin, and then he put her on Cymbalta, and she gained 50 pounds. And I'm like, what are you doing? Like, you're not sleeping because you're going through menopause. Let's get you on natural hormone replacement. And so we did, and she got back down to her original weight, and she was sleeping and happy, and she was so glad that I told her, like, stop what you're doing. And the other medication wasn't working at all for her.
Yeah. Well, two things I want to say. The first thing is that is the typical experience for many women who think they are doing the right thing. They go to their doctor, they know that something isn't right, they're experiencing symptoms, they go to their doctor, they say, I'm going through X, Y, and Z, can't sleep, low energy, feeling lethargic, a bit of anxiety, not really feeling myself. And the doctor prescribes according to the symptomology, according to the symptoms. Not sleeping, take this sleeping pill. Feeling a bit anxious, take this anti-anxiety. Have joint pain, let's give you some, medication to help relieve the inflammation around the joints. which really isn't the root of the problem. The root cause of the problem is you're in perimenopause or menopause. So let's go to the root of the problem and let's figure out a more holistic approach to help you navigate your symptoms.
Right, exactly. And, you know, I check labs. I check to see
what
where.
I wanted to ask you. That was my next question. What is the process? A woman comes to you and says, I'm suffering with, you know, not being able to sleep, low libido, low motivation, feeling lethargic, weight gain, whatever her symptom list is. What do you then do?
Menopausal symptoms that they could have, and they'll tell me yes or no to what they have. And we talk about what they've tried before, if they've tried anything, you know, whether it's acupuncture or it's herbs or it's yoga, meditation. So I see what they've done. I ask about their stressors, what's going on in their lives, because that will have a big effect on hot flashes, insomnia, and anxiety and depression. So you kind of get that history. And as far as getting labs, I usually check it when if they're perimenopausal, I'll do it when they have their period. Between day 1 and 3 is the best time to check it. In menopause, it doesn't really matter. Just check I check total estrogen, estradiol, progesterone, and testosterone. In the States, I will check free testosterone, which they don't do here. And then I check DHA, which is dihydroepiandrosterone, and that's a precursor to estrogen and testosterone, and that's an anti-aging hormone. As we age, this hormone goes lower and lower. That can help with our energy, with our bone mass for preventing osteoporosis. It can help with fatigue. So I check DHEA as well. And if the person, you know, there's other hormones that are out there too that I don't even know if they're available in Israel, but we definitely use them in the United States. And one is oxytocin. And oxytocin is used for overall a better sense of well-being, and also for a better sex drive, increased sex drive. There's also ointments like papaverine and arginine that they can use on the clitoral area for feeling better sensation in the clitoral area. So there's so many things that one could do that they just don't know that's available for themselves. I'm trying to think what other hormones. Pregnenolone is another one, which is a precursor to cortisol. And so if somebody's complaining of joint pain and insomnia, this hormone could be checked, and we'd see if it's low. We can give them pregnenolone, which you can get as a supplement. You can get it as a cream. You can get it as a lozenge, depending on where you're living, you know, what country you're in.
Right. So you do the lab, you request the lab work, you do all the lab work, they go do their blood tests or their saliva test or whatever test you've asked for. And then based on the results, based on their hormone levels, based on their symptoms, you'll then figure out what hormones they need, in what type of dosage, in what type of way.
Right.
And then you've mentioned the different ways that you can ingest or apply the hormones. And I think that's really important that you expand on that, because I think most women have in their minds, it's a hormone pill, I've got to take a pill, but it's not actually that necessarily like that.
So actually the pills, you know, the bit of estradiol that's in there is metabolized by the liver. So I usually, like I said, I use lozenges, which are, you dissolve underneath the tongue or in the cheek, the buccal area inside the cheek, or you can use creams. And I always say with the patient, if your skin is dry, if you see you put the cream on and it absorbs, you know, quickly under say 40 seconds, then that means the cream will be okay for you. But if it's sitting there on the skin and it's not absorbing in, then the lozenge would be best off for them. So it really just depends on the skin type, if they have dry or oily skin, how they're absorbed. And then I check labs in the beginning, you know, like when they have it, like usually in 3 months from the first time they start, I check again to see where their hormones are at, and also their symptomatology. So, and it's really an art and not just a science. Like you have to look at it as both. And, you know, a lot of doctors will do the saliva test because they feel they're more accurate. The saliva is over the course of a month, whereas the blood test is like that particular day. But again, when you're getting their symptomatology, I think after a while you can even just focus in on the blood tests and their symptoms and figure it out. There's a standard dose, there's a lower dose, there's a higher dose. I always start conservatively, and again, just depending on what I'm seeing in the labs, what their symptoms are, and you know, using the standard dose or a lower dose is where I usually begin with somebody. And you know, I really highly recommend that people read. I think it's a great book, Breakthrough Medicine, which is written by, what's her name again? All of a sudden I'm blanking out on her name. Breakthrough Medicine.
I'll check as you're talking. I will Google it. It's called Breakthrough.
Listen, she's a singer. She's a singer, and she interviews all these actress singer. She interviews all these physicians that are working with bioidentical hormones. I don't know why I'm blanking. I see her face in front of me, but I'm blanking her name. Anyway,
look as I break through how the
Breakthrough Medicine.
I
don't know why.
The thing that's coming through here, breakthrough how the 10 greatest discoveries in medicine saved millions and changed our worldview.
No, Breakthrough Medicine. It's called. Let me think. Singer, actress. She's done a lot of work with. She herself had cancer. She had breast cancer, but she was estrogen receptor negative, and she started using bioidentical hormones. And
Suzanne Summers.
That's it, Suzanne Summers. I just got it when you said, like before you said it. Suzanne. Yeah. So she has a great book called Breakthrough Medicine, and she interviews maybe like 15 integrative physicians that are pioneers in the field of natural bioidentical hormones. And it's an excellent, excellent book. I really highly also recommend Christine Northrup's book, Women's Bodies, Women's Wisdom. It's an excellent book. Also on the transition of women going through perimenopause and menopause. And she talks a lot about natural hormone replacement therapy as well. It's a great read, talking about emotional, spiritual, and physical symptomatology that, you know, one may have when they're going through menopause. So these are wonderful books to read and educate yourself. I actually wrote a book, and in that book, there's a chapter on bioidentical natural hormone replacement and cases, and my own personal experience with it. I've been on it since I was in my early 40s.
Okay, so are you happy to share your personal experience?
Sure. I don't know what I would have done without him. I was a mom raising 5 boys, working full time. My husband was unemployed at the time, so I was kind of in a stuck situation that way. And I overdid it growing, you know, I was a gymnast, so scholarship and everything. So I was working out 3 to 8 hours a day at the time. And my hormones were low from the sport and not eating enough and that whole period of time, and then having children one after the other. I was getting severe chest pain, like stabbing, crushing chest pain. It was so bad. It wasn't like a pressure like you get when you have a heart attack, like a pressing pain. It was like a stabbing, crushing pain. Wow. It was worse before my periods, like between about 10 days before my period, it would get even worse. And I would have really bad anxiety, insomnia. It was horrible. And I was just getting the natural progesterone and putting it on.
How old were you around this stage?
I was about 42.
It's really important that we let women know the ages that these things happen. Because at the age of 42, a working mother with 5 kids, knowing that you are the main breadwinner with all the other things that are going on, you would think you're having a heart attack or you're suffering from some type of, desperate disease at that age, and the stress and the anxiety. But But at the end of the day, at the age of 42, it can be perimenopause, but we just don't know. We don't know how to recognize those signs.
Right. So for me, I had labs done and my estrogen was very, very low, and my progesterone at that age, even though I was getting my periods monthly then, but very, very low estrogen and progesterone, way under what it should have been. And so I started on progesterone first, because progesterone does convert, a little bit of it converts to estrogen. So sometimes for some people, you can just start with progesterone when they're in perimenopause, and that alone may just do it for you. But it did do it for me. Well, in the beginning, I used just like they have in the health food store. You can get it online. It's like 25 milligrams to 40 milligrams of progesterone. But that wasn't enough for me. I needed 100 milligrams of progesterone. You can go as high as 250 milligrams of progesterone if you're really.
You found a doctor that was willing to give it to you, or you prescribed it to yourself?
So I talked to I worked for other patients. I had a pharmacist that I worked with, and she worked with me, because it's hard to be objective with yourself, it's not so my friend, I actually went to my friend who was a midwife, and I'm like, I'm putting on this progesterone, and I don't know if it's really working. She's like, Barbara, you're using like 25 milligrams of progesterone. It's way not, you would have to put the whole bottle on you in one day. She's like, why don't you call you can't be objective about yourself. So I was like, yeah, you're right. So I spoke to the pharmacist, and she was like, yeah, let's put you on. I think she started me on 50. I went up to 100 at one point. Now I'm back onto 50 of progesterone. And then once menopause hit, I started the natural estrogen, which was, they both like grounded me, like just put me back on the ground. I felt like before my period, a week or two before my period, I felt like I was out of my body. That's what it felt like. I just can't explain it. And it's very interesting, coffee, and even when I was in medical school, the stress of medical school, but coffee was such a stimulant for me. I would get palpitations, and I was like really up and then crashing. And once I got on the estrogen progesterone, which I thought was very interesting, I could have coffee and go to sleep. Like, it didn't affect my heart that way anymore. I didn't have palpitations. So I was really low in these hormones all since the gymnastics, really. So I was a really critical case. I was an acute case.
Well, I think what you're expressing is really interesting. And it's sort of what we've talked about a little bit here at the summit already, is that where you are today, your menopause experience today, is not based on what happened yesterday or today. It's based on what happened 10 years ago, 15 years ago, 20 years ago. The way that you show up for perimenopause, where your hormone levels are, the hormone resilience you have, the hormonal health you have, your own health and well-being, how you can cope with this very normal but fluctuating, crazy hormonal time in perimenopause and menopause, is very, very much based in what has gone on in the 20 years beforehand. And I think that's a great example, because even though you had a crazy life, now you are well enough informed.
My life. So it's like, medical school, gymnastics, medical school residency, 80 hours with 2 babies, it just goes on and on, and the hormones really, really help me. And I have no side effects whatsoever. I feel great on them. I sleep great. My anxiety is not there anymore. I don't have any hot flashes. And I'll tell you, if I stop them after 2 days, like say I forgot them, I left them home and I went away or something, after 2 days, I start getting the hot flashes.
So that's my next question. I know that women are asking down the screen, how long do I take them for? 3 months, 3 years, 30 years? Like, what is the prognosis? Once you're on HRT, are you always on HRT?
Okay, so that's kind of really up to you. I'm a supporter of it. I'll probably stay on it for life, because it's going to help my bone density. It's going to help with my skin. It's going to help with vaginal dryness. It works really well for my nervous system. And I know my mother also had a hard time, and sometimes it's genetic. You see it in the family. My mother would have hot flashes in her 70s, and she felt achy when she wasn't on natural hormones. So I was prescribing my mom, up until she passed away, which, really she was felt achy. She would have joint pain without it. She felt that, and she had the dry skin and the hot flashes. So I guess I'm like her in that way, and I just do well with it. So I'm going to stay with it. But
Yeah,
I would. Some people, their hot flashes will last for 2 years. That's the average, 2 to 5 years, and then they can go away. And then it's really up to you if you want to be on them or you don't want to be on them. I mean, you know, if you read Suzanne Summers' books, she's a real proponent on how it's anti-aging and helps you feel more youthful.
so that's what I wanted to talk to you about. Many women have probably been influenced by the HRT cancer relationship discussion. Estrogen is cancer inducing, or if you have a cancer risk in the family, you want to stay as far away from estrogen as possible. I know there has been a lot of research in the last 10, 15 years, really as a result of that 2002 research that came out that created that very wrong assumption of estrogen cancer relationship, that is really showing that estrogen is protective, it is important for long-term women's health. So I just wonder if you could talk to that whole sort of conversation, because I'm sure there are some people thinking, like, taking HRT for the rest of my life, like, isn't that going to be detrimental to my health?
Right. So again, this is natural, made from yam and soy, and it's mostly estriol rather than estrone or estradiol. So the clotting issue is way less. Although if somebody had a clotting factor abnormality, I might go on a lower dose with them, or I might go with just progesterone with them, because it may have an impact, or I'll just do estriol, forget the estradiol altogether, 100% estriol. Again, quality of life is really important. The other is the progesterone. Dr. Lee has written written on natural progesterone, which again is definitely great for fluid retention, the blood vessels, circulation. It's a very, very helpful hormone, and it's something that we produce when we're have our menses. Every month we're cycling with estrogen, and then progesterone goes up, and then the progesterone drops, and then you get your period. So this is what we're doing. So we don't want to do unopposed estrogen where we're just doing estrogen and without the progesterone. We want to make it as if we're still there with the estrogen and progesterone. And so that's what we do. It complements the estrogen. You have to understand, if there is fibroids or polyps, fibroids and will the estrogen, or endometriosis, estrogen will promote growth of these things. So if somebody has these issues, I would go with progesterone, possibly a low dose of estriol. And if they have any bleeding, the biggest thing is bleeding issues with polyps and fibroids. And if there's any bleeding issues, then we have to really be, it's case by case. We have to be more delicate with the amount that we're using. But in general, besides, I've been doing this since 1991, and I had 2 cases of breast cancer. One was estrogen and progesterone receptive negative, so that it wasn't even related to either of those hormones. The other one was positive. We caught it early, and she went off the hormones, because if she's receptive positive, then with the hormones, there's a possibility that will promote it. So it's just case by case. Again, we're using estriol. Suzanne Summers talks about her here. She had breast cancer, and she's such a proponent, and that's why I really recommend her book, Breakthrough Medicine, how she interviews these physicians. She's not just she's talking about herself, but then she interviews these doctors, these MDs from the United States who are utilizing these hormones, and the results that they're getting. And like I said,
another doctor who has written very eloquently and in much detail about estrogen, and that's Dr. Avram Blumberg. Have you heard of him? Yeah. So he has written the book, and if anyone is interested to really understand the positive impacts of estrogen on a woman's long-term health and well-being, his book is Estrogen Matters. by Dr. Avram Blumberg, and he has written a lot about the protective nature of estrogen. And as you very clearly explained, as your mother, as an example, one of the aging that we assume that we are going to experience, the aches and pains, the dry skin, the osteoporosis, the higher risk of cardiovascular disease, the diabetes, all these aging diseases that we think we are going to have as we age, actually is partly related to the loss of estrogen. And if we maintain levels of estrogen, estrogen is really health protective, especially in women. And so, again, as you very, very correctly said, every woman is on a case-by-case basis, but in general, we definitely want to make sure that whether naturally or in any other way, we keep our estrogen levels at a certain baseline for the long term.
Right, because we don't want to waste away. We want our bones to be strong and dense. We want our joints to be strong. We want our circulation to be good. We want our nervous system, because we have to think of psychoneuroimmunology. So the neurotransmitters are in the nervous system are very much related to our hormones, our endocrine system. They all like work hand in hand together, and our immune system. And for me, all I could say is, like, I don't have any health issues, thank God. And I've been on this since I was 42, and now I'm going to be 60 soon. So, and I've been working with this since 1991, a long time. And believe me, I haven't had any, if you go a little bit, I mean, I talk about the nuances. If you go a little bit too high on progesterone, you can get a little moodiness. So I always tell a patient, and that's the art of it. I tell patient, if you're feeling moody, let me know, we'll lower it, right? If you have any breast tenderness, I'll make sure to lower the estrogen a little bit. Acne, I'll make sure to lower the progesterone and testosterone a little bit. If you're having any hair loss on your head or facial hair, I'll lower the testosterone. So I make sure they know what is going to be, what can be, and these possibilities are small, but yet they're possible. It's like with anything, you could take an herb, you can eat a food, it doesn't matter. So I make sure that they're aware, which is really, patient education is really, really important. And I also make sure that their lifestyle is good, like they're living a balanced lifestyle, because, less is better. And, if you want to balance estrogen and progesterone as much as possible, then, meditation and yoga and exercise and breath and learning to say no and learning not to take on more than you can handle. All these things are all part of the package. And I could just say personally, and with the patients that I've been with, in my experience, I've had only good things, only good things.
Amazing. This has been such an amazing conversation, so helpful and informative and important. I just want to, before we finish, two things. Firstly, accessibility in different countries varies. Is that true?
Yeah, it's government, regulations on the compounding pharmacists. And at a time, the FDA was like, they were threatening they were going to shut down compounding pharmacists, and they were causing a little rift. But in the end, it didn't do anything. So,
and I know that there is also this phrase, bioidenticals and body identicals. And I think in the UK, the difference, I don't know whether that the body identicals and bioidenticals is a reference point in America, but I know in the UK, one refers to the regulated sort of bioidenticals, more natural, and one relates to the unregulated, much more personalized.
Interesting. Okay, so we work with, whether it's synthetic hormones, the regular HRT, or bioidentical, meaning they're compounded and they're individualized per person.
I'm going to tell you, if I can just find my notes here. So body identical is regulated and approved with a set dosage and is licensed. And bioidentical, this is again in UK terminology, bioidentical is unregulated, uncompound HRT, custom made according to the patient's needs.
Okay,
And
so
because of that personalized nature of dosage, it's difficult to regulate them.
So that's interesting, because in the United States, it all goes through a compounding pharmacist. They are regulated. They are, they have, the government comes in and checks their equipment, their rooms. That all has to be sterilized. So they are regulated by the FDA, the compounding pharmacists. But you can custom make. So that's interesting, depending on the country. Yeah.
And in Israel, what's the situation in Israel or in other places? Are you familiar?
In Israel, it's interesting. So the creams they make here, for sure. The lozenges, a lot of times they get them from Germany, or they get them from another country. I think how Galil gets them here. There's other ones like Tapachnik gets them from other countries. Sometimes it's weird. It like comes and goes. It could be that like there's a period of time when they're making it, and then there's a period of time they're getting it from abroad. It's like
right.
So, I still have my license in the States. So sometimes I just I have patients, if they're going back to the States, I find I have to say I find the hormones, the creams better absorbable, because I've tried the hormones here, and I found the creams absorbed better in the States, the way they made them. It's better quality. And I found the lozenges way stronger. I had to take a quarter of a lozenge in Israel. Wow. That had the effect as a whole lot. Like it was like I took the whole lozenge and I was starting to have like different symptoms. I was like, So I started to cut it back, and it got to a quarter. So I don't know what they're doing here per se. Sometimes I don't. So I have to really check hormone status, and I'm much more like go lower here in this country over the United States. But again, some people do live in the States, or they have relatives, and then I work with the pharmacy here.
I think one of the most important messages you're saying, which is coming up time and time again in all of my conversations, personalize, listen to your body, track, monitor, pay attention, because as you've said, like you ask your patients to report back on how they're feeling. And it's not just pop the pill and you'll be fine, come back and see me in 3 years' time. It's take the pill, be in touch. We'll do testing. We'll see how you're doing. Let me know how you're feeling. This very personalized self-awareness and monitoring and listening to your body.
Absolutely. Absolutely. It's very individualized, and everybody responds in a different way according to their body type. And if you study Eastern medicine, Ayurvedic medicine, there's different body types, and some people are more sensitive to herbs and medications compared to others. Like one person could take Advil and be knocked out, and another person takes it and doesn't feel a thing. We're all very different according to how we are, our body types. So it's just very, very personalized, and there's protocol with it. There's a protocol as to what's normal and what's a low dose and what's a high dose, and there is that protocol, but within the protocol is the art of treating.
Amazing. So before we wrap up, one thing that you wish women would know, that you wish your patients would know before they came to you, or that information. You said you have sons, but if you have to your daughters-in-law, what is the one thing that you wish women would know?
The one thing is, if they're going through perimenopause, whether their periods are irregular or heavy or too light, or they're having mood swings, or they're getting hot flashes now, etc., through menopause, there's something that you could do. And if you're doing everything from diet to exercise to yoga, etc., it's working great. But if it's not, there's something you could do, and you could have a better quality of life and live a happy, healthy, long life rather than suffering. You don't have to suffer.
I think that's the most important message here, is that you don't have to suffer. We assume that you have to. We assume that this is just the way that it is. And I don't want to go on antidepressants, so I'm just going to have to suffer through. But you don't have to suffer.
Exactly. You do not have to suffer. I'm a product. I'm a product of not suffering anymore.
Amazing. Dr. Barbara, thank you so much. This has been so amazing. All your contact details are here on the page where this video is. So if you want to reach out to Dr. Barbara, if you think that you definitely need some hormonal support and you want to go in the bioidentical direction, then please reach out to her. As you can hear, she knows exactly what she's talking about. She's been doing this for a long time. She really is the expert in this area. So thank you so much for joining me.
My pleasure, and thank you so much for helping other women. Thank you.
And everyone, I will see you at the next session in the Menopause Summit. Have a great day.